Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center on this Tuesday. Joining me right now, if you can't tell from the title, is Columbus Public Health Commissioner Dr. Mysheika Roberts. Thank you so much for being with us, Dr. Roberts. Lots going on. Really want to focus on obviously the upcoming holiday, what is usually one of the biggest party days of the year, combined with the Sugar Bowl, which is on a Friday night. But let's talk about the vaccine. How are we doing here in Columbus with the vaccine? Are we on track? Are we behind? Are we ahead? How is the distribution going, and who's gotten it so far?
Well, I think the distribution of the vaccine is somewhat of a mixed bag. I think our hospital systems have done an excellent job of getting the vaccine in the arms of their associates. A lot of that has to do with the fact that their associates are at work. They're critical infrastructure healthcare workers, and they're coming to work every day. So I'm pleased to see what they've done. But, we have to realize that we got this vaccine in the midst of a holiday time. And so we've got lots of people who are eligible for the vaccine that might be on vacation, whether they're in town or out of town. But there is something they just don't want to consider during the holiday times. So we've been offering the vaccine clinic to our first responders, specifically EMS and our home health providers, our long-term care providers, as well as outpatient care providers. We're hoping that the uptake of that vaccine picks up next week when the holidays are over.
So I was just on the Ohio dashboard, which I think is up. It's a little bit behind on there. It said in Franklin County about 5,700 people have been vaccinated so far. Is that about right?
That's probably about right. We're probably closer to 6,000, but that's about right.
All right. So how do you guys inform people what's going on? Do you get in touch with, I guess, doctor's offices or healthcare clinics, or how does that all work? How do you reach out for them to know to come to you guys for the vaccine?
Great question. So we know who's in tier 1A. The state, or phase 1A, I should say, the state has given us a list of those individuals. So we've reached out to them proactively to see what their need is. How many employees do they have? How many staff do they think will need to get vaccinated? EMS are coming to us. They're coming to us at the fairgrounds, and we've been vaccinating them there. But for the private provider offices or the smaller group practices that aren't associated with a hospital, if they have more than 50 staff, we are actually giving them the vaccine to vaccinate themselves. Mm-hmm. If they have less than 50 staff, then we're bringing them to the fairgrounds or having them come to the fairgrounds where we're vaccinating the staff there. So we notify them. They've all enrolled on our system saying that they want to get vaccinated and they meet the criteria. And then when their turn is up, when it's their turn to come, we contact them and say, either we're going to bring you the vaccine or you need to come to the fairgrounds to get vaccinated.
Okay. And so that's going well, it seems like. So what is the cutoff, not cutoff, I want to say, but what is the date where you guys are moving on to phase, I assume 1B would be the next phase, and who is in that?
Right. So in terms of a date when we're going to move to 1B, we don't know that exactly. Mm-hmm. And it's clear that we might not finish phase 1A before we start phase 1B. So who's in phase 1B? That's a big population. It's everyone over the age of 65. It's individuals who were born with a congenital disease or some developmental disease or issue that would put them at higher risk of having the virus or complications of the virus. And then it's teachers, anyone who works in a school who could be around kids. And really the emphasis of that is to get our kids back into the classroom by March 1st. I really want to let the public know that Ohio has chosen to vary or to alter its phase 1B a little bit more than what CDC, or actually less people than what CDC had recommended. So we are more restrictive in phase 1B than what CDC had recommended. And the governor has a great explanation for that. And he's really looking at how to save lives. And we know those over 65 are more likely to die from complications of COVID-19. So he wants that group vaccinated. So he's looking at those who are most at risk. And then how do we get our lives back to normal by getting our kids back in school? And that's why we're focused on teachers.
Yeah, over 65, that is a huge population. That's My parents, of course, just
My parents.
yeah. So definitely a huge population there. I know. Just speaking anecdotally, my mom reached out to her physician, and like kind of like you said, they don't know yet. They don't have a date specifically for that yet. How will that be announced? Because that seems like such a huge rollout with such a huge amount of people. Are people over the age of 65 going to be able to, how is that going to work? Just logistically, teachers over the age of 65, all of those people, kind of opening the floodgates of wanting to get that vaccine. Will there be clinics? Will you guys be going into schools, helping out private practices, etc.?
All right, so people will be able to get the vaccine in a variety of different settings, but our communication plan will have to be very succinct and clear to individuals of where they can get the vaccine when it is their turn. So when we open it up to phase 1B, we will be communicating to the public on every different venue we have to share with them where they can get it. And we anticipate people will be able to go to their private providers. They'll be able to go to pharmacies in town that will be providing the vaccine. They'll be able to go to their local health department or wherever their local health department is providing the vaccine. So there'll be multiple venues, not only for those who are over 65, but also for our educators, our K through 12 educators, to go and get the vaccine. And we here in Columbus are committed to communicating with the public or to the public of where those locations are when the time is right.
So for people that also, that group of people might be a large group of people who might not have insurance, especially for those over 65. Is this going to cost them anything? And then people who do have insurance, is it run through their insurance and it doesn't cost them a deductible or anything like that if they visit their doctor?
That's an excellent question. And so, as many people know, this vaccine is free. The government paid for the vaccine, so there is no charge for the actual vaccine. There are some locations that might charge an administration fee, the fee to cover the nurse or the provider who's actually giving the vaccine. I can tell you from the public health perspective, we're not going to take money from anybody. So if someone has insurance, we will bill your insurance for the administration fee, but we will not charge the individual coming to us any out-of-pocket expense for that vaccine. We're still waiting to get some clarity from the state if our pharmacies will do the same thing or how they're going to manage that situation.
All right, I'm just looking over our Facebook comments here. I want to say good afternoon to everybody who's watching. If you guys have any questions for Dr. Roberts regarding the vaccine, regarding COVID-19, please leave them in the comments right now, and we'll be sure to skim through them and ask. All right, so we talked about schools hopefully getting people back in the classroom, students back in the classroom by March 1st at full capacity. What else do you, what is your other goals for the next 90 or 60 days?
Well, clearly we want to vaccinate as many people as possible, but we also want to tell the general public that because we have a vaccine that provides hope on the horizon, but we have to be really clear. It's going to take time to get many people vaccinated. So people still need to follow those public health recommendations. Stay home if you're sick, avoid those large crowds, wear your face mask, keep your distance. Those things still have to be done, and wash your hands. And so we still need to continue those behaviors for a period of time until we get more individuals in our population. So my goal over the next 90 days is going to be twofold. Do everything we can in our community to reduce the number of cases so we can also reduce that impact on our hospitals. We don't want to be another California. I watch the nightly news every night and I see what's happening in California. I do not want that to happen here. And then we want to vaccinate people. We want to continue to vaccinate as many people as possible. I'm really proud of my team and the work we've done and the setup we have at the fairgrounds to vaccinate people. And we have the capacity to vaccinate a lot of people in that space. So we want to get those people in as quickly as possible, get them back for their second dose so they're fully immunized, and then get the next group going.
So you mentioned California and the issues that they are having with their hospitals right now. How are our hospitals in Franklin County looking? And do you think the stay home advisory that went into effect, what, like 6 weeks ago, a month ago or so, how did that have an impact on us and our hospitals?
So I can say that our hospitals over the last week have shown a definite decline in cases, which is good news. They're starting to see some relief there, and we want to be able to sustain that. I can also tell you the stay-at-home advisory appears to be working. It unfortunately expires this Saturday, January 2nd, alongside the statewide curfew that expires this Saturday. But it appears to be making an impact. We've seen a decrease in cases over the last 3 consecutive weeks, but we want to continue that. We want to continue that decrease in cases. So whatever our community needs to do so that we can see a sustained decrease in cases, that will help not only our hospitals, but also everyone in our community.
Do you and Mayor Ginther have any plans of extending the stay-home advisory here in Columbus and Franklin County?
At this point in time, we don't have any plans of extending it, but that's still a possibility that we could.
Okay. All right, so we got to turn and kind of pivot towards what's going to be happening over the next few days. What would you like to say to the people of Columbus, to the people of Franklin County, and even people all over Ohio who are watching right now about their New Year's Eve plans, and then moving on to New Year's Day, the Sugar Bowl that is going to be on a Friday night at 8 o'clock?
So I want to tell people what I've been telling them all along. Enjoy the festivities at home where you're safe with the people in your household, and bring people in virtually. Do not bring them in your home. People have a lot of false sense of security when they get tested in advance of an outing or a gathering. That test only tells you that you're negative at that point in time. If you have not appropriately quarantined for 2 weeks prior to that test, meaning that you didn't go to work, you didn't go around other people, then that test could give you a very false sense of security when you go to that holiday party or that football party. So celebrate New Year's Eve at home with your household, bring in other people virtually, watch the Buckeyes on Friday night at home with your household contacts, bring other people in virtually. Try not to go out and engage with other people, whether it's in someone's private residence or someplace else. We still need to limit our activities for the next few days to really reduce the spread of this virus in our community.
Hey, as an introvert, it's always been the way to go for me. It's the best.
Sound like my husband.
Yeah, I've always enjoyed New Year's Eve better at home. It's warmer there. All right, so we have some really good questions rolling in from some of our people who are watching on Facebook. Sandra is wondering, what about the people who have asthma or any type of lung issues? Are they included in phase 1B?
They are not included in phase 1B unless it's something that they were born with, a congenital disease that has caused their lung issues. But those with chronic health conditions will be included in a later phase.
Okay. Diane is wondering if someone has had COVID-19, do they still need a vaccine, and are they immune already?
So what we know about people who've had COVID-19 is they have some immunity for a short period of time after their infection resolves. And yes, we do want them to get the vaccine when their time comes.
Leah is wondering, will it be a requirement for kids to get the shot before they have to go back to school, at least here in Columbus?
So keep in mind that we do not have a vaccine that has an approval, whether it's an emergency use approval from the FDA yet for kids. The vaccines that are on the market, the Pfizer is for 16 and up, and the Moderna is for 18 and up. So there is no vaccine for kids yet. And I do not anticipate that it will be a requirement for kids, or for that, in fact, for any employee to get the vaccine before going back to work or going to work.
Another Leah is wondering, how long is the vaccine good for? Do we know that yet?
We don't know that yet. And so that's the big unknown. And there's going to need to be more work and more research in that area for us to get the answer to that.
Okay. More questions here. Kathy, Dr. Roberts kind of already answered this one. What's the expected date for seniors to get their vaccines yet? We don't know quite yet. Do you have any kind of ballpark? Will it be weeks? Will it be months?
I'm optimistic that it'll be sometime in January, but it'll probably be the latter part of January before we get to that group.
Okay, that's I think reassuring for the seniors who have really been avoiding their family gatherings and different things like that. More questions, kind of specific questions. People who have COPD or autoimmune disease, very similar to asking about asthma and stuff like that. So if it's, you said.
It's not phase 1A or 1B. Right. It'll probably be phase 2.
Okay, got it. Cindy is. This is a really good question. Will you guys be coming into the schools to vaccinate the staff members?
Well, there are a lot of staff members in schools,
Okay.
so we're still trying to figure that out. I think every health department's going to do it differently. So here in the city of Columbus, we will likely have our teachers come to our vaccine clinic at the fairgrounds. But again, every health department can manage that differently.
Okay. Mary's wondering, does the second vaccine have to be the same brand as the first vaccine? So if you take the yeah, I thought so.
Absolutely. If you get the Pfizer, you've got to get the second dose in the Pfizer. And I want to remind people they're not getting that 94, 95% protection until they've gotten both doses. The first dose only gives you about 50% protection. So you still got to wear the face mask. Even after you get both doses, we still want you to continue to wear your face mask.
Another question is really good one. We've been seeing national shortages. I haven't seen anything here in Ohio, but have you guys gotten the anticipated number of vaccine doses that you thought, or are you seeing less than originally anticipated as outlined by Project Warp Speed?
Yeah, here at Columbus Public Health, we've gotten what we anticipated getting. I know some of our hospitals now have received their vaccine. Some of them got them a few days later than they had anticipated.
All right. And Mike, I know you are watching right now. Neither Dr. Roberts nor I are on a teleprompter right now. So just so you know that we are asking these questions and answering them from the top of our heads. So thank you all so much for those questions. One last question for you, Dr. Roberts. We all saw the videos of the UPS trucks rolling in with those vaccines a couple weeks ago. And then we saw you administering to your staff the first dose of the vaccine. What did that feel like for you?
It feels like hope is on the horizon. You know, this has been a tough 2020. And for those of us on the front lines here in public health, we've had to endure a lot. And I'm really pleased with my staff. So to be able to offer that sense of hope and protection to my staff, as well as to everyone in our community, it just filled me up with pride and joy, but most importantly, hope. And I'm looking forward to 2021. At least maybe by summer of 2021, we'll be in a much better place than we are today.
I have one last question because it is a very good one. I know the answer to it, but I want everyone to hear it from you. Do you need a mask after you get your shots? Are you going to continue to recommend mask wearing while in public?
Absolutely. Mask wearing is going to be with us for a while, and we just need to embrace it and accept it. It's going to take several months, almost probably close to a year, to get our community appropriately vaccinated. So masks are still going to be required and expected throughout Columbus and Ohio.
All right, Dr. Roberts, thank you so much, as always, for being with us. I really, really appreciate it. Anything else you want the public to know right now?
Just have a safe New Year's and go Bucks.
Go Bucks. All right. Dr. Roberts, again, thank you so much for being with us. I really appreciate it, guys. I will put this full interview up on NBC4i.com here in just a few minutes, and then I will share more of it with you coming up on First at 4 as well as NBC4 at 5. Again, NBC4i.com for more information, and then I will put this full interview up here in just a few minutes. Thank you. Bye.